how is this facility going to benefit this community?
Our community does not have enough mental health resources, and they haven't for some time. And over the last 10 years, there has been an increase in needs, but not an adjustment to try to really meet the needs in a comprehensive way. So by adding these acute psychiatric beds, our goal is to help do our part to help the community in meeting the community needs in terms of mental health and those who are experiencing mental health crisis. From 2019 to 2021, our emergency departments found that there was a 68% increase of patients showing up at the emergency department with mental health needs. Children's Mercy in the last year received almost 4,000 children in their EDs experiencing behavioral health and mental health issues. And so it's been a concern. We're currently, the Surgeon General says right now that we're experiencing an epidemic of loneliness, and we're seeing the ramifications of that. We're seeing the ramifications of COVID. We're seeing the ramifications of excessive social media usage, and our children and our community is not at the level of well-being that we really need it to be. So we aren't going to fix everything with our hospital, but we hope that we make a positive contribution.
So the issues that you say from 19 to 21, that really hastened the venture, the joint partnership.
Yeah, I think we've all experienced a sense of urgency. I personally experienced working with Camber Mental Health. We have seen the amount of children who've been waiting for a bed, and waiting for a bed is just not okay in general. But when we find that patients are waiting in emergency departments for hours, days, months, in some cases, it's just not okay. We have a saying at KVC, and it's, what would you want for your child? And I would not want my child to experience that. And so it's just not okay for us. And so this is us really trying to meet the needs. And yes, that is a very big factor, and that probably expedited it. But I think we already felt a sense of urgency even before that.
And without this facility here that we're standing in, that's going to be opening to Johnson County, Kansas City, where do they go? Where were they going?
Well, there's other mental health hospitals in the area, but what our goal is with opening this one is that we're reducing the amount of time that patients are waiting in emergency rooms. We're also making sure that patients aren't being turned away in other areas to make sure they're receiving the need that they have. Our goal is to increase the number of inpatient psychiatric beds to make sure that we're able to meet the needs. And if they're not being met here, we hope that they're able to be met in other hospitals. But sometimes they're waiting in emergency rooms, waiting for that bed to open up. This mental wellness campus is over 72,000 square feet. And we have really tried to maximize the square footage to be patient-facing and to enhance the patient experience. And I can't say enough about our partners, Hafer Welker, J. Dunn, who've really helped make this be meaningful and to really help us execute this in a way that allowed us to open up earlier than we had expected.
Having this across the street from KBC headquarters, that has to be just phenomenal. Having, like you said, the campus, but having it literally 100 yards from the corporate office.
Yeah, we love being in Olathe. We feel like our Olathe partners are exceptional, and it's so helpful for us to be right across the street. I don't know what my team would say about me being across the street because I have easy access to them at all points in time. But it's very helpful. It helps make the entire process of opening a brand new hospital that much easier.
And as far as what made this possible, help and the Sutherland Foundation, who else was instrumental in making this happen?
Yeah, there's so many people that had a positive impact in making this happen. The Sutherland Foundation, as you mentioned, was a big one. The state of Kansas also provided funds for us to be able to open, amongst many other donors that have contributed to our wellness campus. It would not be made possible without them. And I would be remiss if I do not mention all of the employees, whether it's on the Camber Mental Health side, our KBC Health Systems corporate office, Children's Mercy. It has taken so many hours and resources and time to make this happen. And I'm just internally grateful for that.